Hello, this is Congressman Brad Sherman. I'm from America's best named city, Sherman Oaks. Welcome to our San Fernando Valley Telephone Town Hall, coming to you live from the Rayburn House Office Building across the street from the United States Capitol. I'm one of the few members of Congress who's working in the Capitol every day. Last Friday, we passed major legislation that I'll be briefing you on. Today, we swore in a new member from California as a result of a special election in the area to the north of the San Fernando Valley. And they needed a member from California, the senior member, to introduce the gentleman who was being sworn in to finish out the next few months of the remaining term. And next week, we'll be voting on other legislation, and I will brief you on that. By being here, I think that I'm in the best possible position to influence legislation, to meet with people 20 feet away from me on both changes in the statutes, but also in how some of the agencies here are carrying things out. We will be on this telephone town hall for an hour, and I'll soon introduce our special guest, Dr. Nirav Shah, and I'll explain his incredible qualifications in just a few minutes. This is our fifth coronavirus crisis town hall. Our program will be an hour tonight. We'll be doing our sixth telephone town hall on this crisis on Tuesday, June 2nd at 7 p.m. It's my intention to have a telephone town hall every other Tuesday, 7 p.m. Pacific time, and to keep doing it until I can have a Dodger dog at Dodger Stadium, or, God forbid, go to a Rams game. But as long as this crisis continues, we will continue to reach out to the San Fernando Valley and get input as to what we should be doing here in Washington. Now, if you want to know about our next town hall, if you want any information about what's going on in Congress, and especially if you want information about the various programs designed to help people during this crisis, go to the website, bradsherman.house.gov. And you'll see a place there to give us your email address. You'll see a place there to sign up for our next town hall. And if you do sign up, you'll be able to submit a question in advance. And you'll also see a place to click to get information about all the various government programs that are taking place during this crisis. So save the date, Tuesday, June 2nd, 7 p.m. Also, you ought to write down the following phone number. If we get disconnected, you can dial back in to 877-229-8493. And then you enter PIN number 13402. And you can do that exactly 2 weeks from today to dial into our next town hall. Again, the number for the town halls is 877-229-8493, and then PIN number 13402. And if you weren't able to write that all down, you just go to bradsherman.house, for House of Representatives, .gov, and all the information is right there. Now, if you want to reach my staff, or you want to make ask a question during this town hall, you dial *3 on your phone. You'll then be connected to my staff. If you have a personal question, a personal issue in dealing with any federal agency, and you just want to talk to my staff, they'll be right there. But most people who dial *3 will want to be put in the queue to ask a question during our town hall, a question that Dr. Shah or I will endeavor to answer, and a question that will be heard by many thousands of your fellow San Fernando Valley residents. Let's see. I am particularly proud of our constituent service program, and you can reach our whole Sherman Oaks San Fernando Valley staff at 818-501-9200 during business hours. And I especially want to salute our district director, Scott Abrams, who continued to work every day from home while his wife recovered from COVID. And I'm so glad that the whole Abrams family is healthy today. Now, one issue that comes up is dealing with the IRS. They are supposed to be distributing the $1,200 per adult, $500 per child economic stimulus package. If you received it, and we may take a survey of people on this call to see who's actually received it, then the system is working. The IRS has released a new phone number for those who haven't received it. It's 800-919-9835. The IRS came to all the members of Congress and said, please get that number out to your constituents. But the bad side of this is it is almost impossible to get a human by dialing 800-919-9835. We tried it. But to the extent a phone tree and a computer can give you useful information, it's there. You can also go and get pretty much the same information at irs.gov/coronavirus/get-my-payment. And this is supposed to tell you when you'll be getting your payment. And there is, if you get a payment status not available error message, try it again, entering your street address in all capital letters. It's absurd to have to say that, but these systems are tricky, and sometimes they work, and sometimes they work only in strange ways. In addition to your economic stimulus payment, this is the time of year when people are expecting their tax refunds. So you can go to irs.gov/refunds to see where your refund is. Now, that information should be available about 24 hours after you submit your tax return by electronic submission, or 4 weeks after you mail in a paper return. The IRS in general and so many things work much better online than they do with paper. And one more thing about those economic stimulus checks. If you're a single person who makes more than $99,000 a year, or a couple who makes more than $198,000 a year, you're not getting the payment. So if you're well enough off to be in that category, there's the reason you haven't gotten a payment is an economic stimulus payment is there is no payment. You of course get your tax refund just like every other year. And if you're a couple between $150,000 a year and $198,000 a year, your payment is phased out, so you will not be getting the full $1,200 per adult. Let's see. I do want to talk a little bit about the legislation that we passed on Friday through the House of Representatives. But remember, this passed only with Democratic support. It's not going to be passed in this form by the Senate. It is, in effect, the opening offer of Nancy Pelosi and all the Democrats in the House working together. It's not like I got to write every sentence of this bill, but it does, I think, reflect the values of the Democratic Party. It is a big $3 trillion bill with $1 trillion to help state and local governments and school districts. This is why we call it the HEROES Act, because it will provide funds to allow us to continue to employ the firefighters, the EMT, the police, the teachers, the health workers. There's a $200 billion of hazard pay for essential workers, $75 billion for testing and contact tracing, an additional $1,200 per family member, same for adults or children, in addition to the $1,200 payments that are already law that I was describing earlier. There's worker safety, there's a provision for under the PPP program that helps small business that gives them a longer period to use the money that they got under the PPP loan to pay employees and then not have to pay the money back. As some of you remember from the last town hall, this PPP program, very popular with small business. It's called a loan, but it's really intended to be a grant to small business who use the money to pay their employees. This bill also has housing assistance, and it includes my bill to make sure that your credit rating is not hurt by not being able to pay bills during the coronavirus crisis. So that's what we passed last week. Next week, we should be voting on bipartisan legislation that will do just a small part of what I just described, and that is it looks like the parties are reaching agreement on giving the small businesses a longer period of time that they can use their money, the money that's lent to them, to pay payroll and not have to pay it back. So I want to remind people to dial *3 to get into the queue. And at this point, I want to introduce our guest speaker, Dr. Nirav Shah. He is a medical doctor with a master's in public health, a scholar at Stanford University School of Medicine, a frequent commentator on BBC World, The Economist, The Wall Street Journal. He's from Harvard College, Yale School of Medicine, National Academy of Medicine, and a former commissioner of health for the entire state of New York, and particularly relevant to those of us in Southern California. He served as the chief operating officer for clinical operations for Kaiser Permanente in Southern California. So, Dr. Shah, what can you tell us? This is a medical crisis. It is an issue of biology. What do we need to know?
Well, thank you, Congressman Sherman. It's really an honor to be here and join your group, speak to the people of the Valley firsthand. I hope we have a lot of good questions over the next few minutes. I thought I'd start by just giving a state of where we are today. You know that we have about 1.5 million cases confirmed in the United States and about 90,000 deaths. That's a lot. It's worse than any recent flu season, and unfortunately the numbers are probably undercounting the actual estimates of what's going on. But with the period of the last 2 months of really tamping down the disease, many counties and states are opening up to business as usual. And so we're really in a transition point of relaxing these restrictions. And what I want to give you is a sense of what to expect and what you should think about both for yourselves, your families, your neighbors, and your loved ones. We have a lot to hope for. Science has really progressed. We are now studying over 100 different compounds as potential therapies for COVID. The reality is that no single drug will ever solve this. Like HIV, like many other viral diseases, it'll likely be a combination of medications, a cocktail of drugs that ultimately helps us keep it in control. And the vaccines are also starting to develop. Yesterday, the stock market rose almost 500 points because of a study that was released a little early. Now, if you actually read the study, it only was in 4 people that had an effect. It was a phase 1 trial. There are still phase 2 trials and phase 3 trials before we even know that it's actually going to work across our population. And so while I am optimistic, this is going to take months, and it will be many months before we have the numbers of doses we need to really protect not only our frontline workers, but everyone over the age of 60, 70, 80, people in nursing homes and congregate facilities such as jails. So to the extent that we're at a transition point over the next few weeks and months, what do you expect to see? Well, one thing we've learned from experiences across the pond and seeing what's happening in Europe and Asia is that it hasn't gone away and that it will likely come back. COVID will likely see something called a second surge, and the extent of that second surge is up to us. It's up to what you do, what every one of us does, in terms of our specific roles in helping to stop the spread. That means, do you still limit your gatherings to fewer people rather than more? Yes. Do you wear a mask when you go out? Yes. Do you still socially distance and try to stay away from people when you are outdoors? Absolutely. Do you help your neighbor who's older and get the groceries for them? Yes. All of the above. And if we do that, then we may be able to still see a growth in cases that doesn't overwhelm our system of healthcare. The reason we shut down in the first place was we were worried that our hospitals and ICUs would be overrun. Now we understand the etiology of the disease and of the natural history, of course, a little better. We're still worried about that, but we're trying to open up the valve because it's a false choice between lives and livelihoods. We know we need to optimize for both, but we have to start with the science, start with an understanding of the disease, and then also see what we can do in terms of trying to expand the list of businesses that are open. Allow folks to get out of their homes because social isolation and mental health issues are also serious. I know I want to keep the most time for questions, so I'll stop there, and thank you.
Doctor, I've got a couple of practical questions. What you can wear gloves. How does that help?
I actually wear gloves sometimes. The way that gloves really help us is it reminds us when you have a big blue glove on to not touch your face, to not rub your eyes, to not infect yourself if you're touching things when you're outdoors. So to the extent that washing hands is the most important thing you can do frequently, certainly those hand sanitizers also work. Gloves are part of the tool set. Everything improves just a few statistical points your chances of not contracting COVID. That's why we talk about there are masks, there are better masks. There's hand washing plus, and gloves is part of that tool set. I wear them when I go to crowded places like Costco. I don't wear them otherwise.
And what about masks? How useful are they in keeping the person who wears them from getting the disease and to keep the person who wears them from not giving the disease? Because with this disease, you can spread it long before you feel it.
So masks are a public health measure that we've seen in widespread use in Asia. The masks that we are currently suggesting that people wear are mostly cloth masks, or not the medical grade N95 respirators or other masks that actually create a more effective barrier bidirectionally between a person and people around them. These masks that we're suggesting people wear are really to help stop the large droplets. If you cough when you have a mask on, you're less likely to make a cloud of large droplets that can infect other people. On the other hand, if you're going to be in a hair salon getting your hair done for another hour and a half, 1 foot away from your hairstylist, that mask is not going to protect you from
Doctor,
your hairstylist.
Those familiar with what I look like are sure that I don't spend an hour and a half getting my hair done. But go on.
Fair enough. But I know many, my wife included, a lot of folks want to get their hair dyed very soon, and that's what is high on the list of what happens when business as usual. And so just realizing that masks are not going to be that protective barrier when you spend large amounts of time in close proximity. If you remember the cases in Washington State, a choir, one person infected almost over 50 people in choir practice, even though they were aware and they were trying to stay a little bit apart because of that airborne, and they weren't singing with masks on, I'm not suggesting that, but that airborne transmission is what we're worried about, and masks do probably more to protect other people when you cough rather than protect you from other people.
And speaking of a choir, I'm told that the louder you speak, or presumably sing, though a little bit further the disease is coming from you to perhaps infect other people. I don't know if I have that right.
That's right. That's why I stay far away from Congress, just for that same. No, I'm just kidding. But the reality is exactly that. And so when we come up with these arbitrary numbers, like 6 feet of social distancing, what does that 6 feet mean? That's an average. Is it indoor? Is it outdoor? Well, outdoors, you probably have a breeze going. It's probably a little safer. Versus indoors in a closed space for a long amount of time, that 6 feet is just guidance. perhaps you want to stay a little further.